I welcome you all to this educational video. I'm Dr. Vishal Pawar. I'm specialist neurologist at Aster Clinic, Discovery Gardens, Dubai. At our clinic, we run a specialized clinic for patients suffering from vertigo and dizziness. And over the last 3 years, we have treated around 1700 patients suffering from vertigo and dizziness. And in the registry, when we analyzed, we found that the most common cause of vertigo and dizziness in Dubai population is vestibular migraine. So I would like to tell you about this particular condition. So in patients with vestibular migraine, the patients can have variety of symptoms in the form of vertigo, dizziness. Patients can have difficulty in scrolling mobile phones. They can feel dizzy while scrolling the screens. They can have difficulty in focusing and concentrating. They can usually they have history of motion sickness. They can get episodic ringing of the ears, episodic blockage of the ears. Usually they have history of migraine, but one third of the patients might have forgotten their history of migraine or might have considered their history of headaches as normal headaches. So it's very important to correctly diagnose these patients, and at our vertigo clinic we do detailed evaluation, detailed history taking, and after that we do vestibular testing, and which helps in the diagnosis of these patients. So coming to the treatment of these patients, so the treatment of these patients depend on is divided into 3 parts. The first part of the treatment is lifestyle modification. So it is very important that there are certain triggers in the lifestyle which trigger this condition. For example, the timetable of the patient should be same every day. So the timing of the meals, like breakfast time, lunch time, the dinner time, the sleeping time, waking up time should be same every day, even on the weekly ops. The second thing is the water intake should be good, that is more than 2 liters of water intake per day. Physical activity of half an hour per day is very essential. Then stress relaxation and management of the stress is very important, and reducing the screen time. So these are the major lifestyle triggers which, if they are controlled, it helps in the control of the symptoms. The second part of the treatment is preventive medications. So there are a certain group of medications which are not painkillers. If they are taken on a daily basis, it prevents the episodes of headache and dizziness in these patients. And the third aspect of the treatment is, whenever the patients feel dizzy, there is a certain group of medication. Whenever the patients feel headache, there are certain group of medications. So it is a treatable condition. It is a completely treatable condition, but unfortunately there is very less awareness about this condition, and it is time to increase the awareness of this condition. And at our vertigo clinic, I assure we will treat you well. Thank you.